When it comes to heart disease, like anything else, early detection and treatment is key to getting better. In this week's Health Watch, Dr. David James tells us about one way doctors detect possible heart defects.
There are many ways that doctors can screen for heart disease. One such way is through a stress test. It's an outpatient procedure that tests the heart while it's being stressed to see how it functions.
We may use just a treadmill, patient hooked up to the monitor, and walk on there, and we get them to a certain heart rate. When we do that, we get EKGs along the way, and the doctor will read the EKG tracings to evaluate for any heart disease.
Echo imaging can also be used in correlation with stress testing. It's an ultrasound of the heart to monitor its pumping action. A third type of stress test is called a nuclear stress test.
In the nuclear stress testing, we use a radioactive isotope, which we give to the patient while their heart is at rest, and it flows through the heart muscle and sticks to that heart muscle. Then we bring them back over, do a set of images, they lay on a table and we get pictures of the heart like that. Then they come and do the stress part of the test. And we can either do that again with a treadmill or we can use medicine.
All types of stress testing are physician ordered, usually after a patient experiences some symptoms of heart disease. The symptoms may include shortness of breath, chest pain, fatigue, or nausea.
It's kind of a step before heart catheterization. It's not as invasive and relatively low risk.
Stress tests can also be used to monitor the hearts of those who've had cardiac procedures in the past to verify blood flow to the heart is still adequate. Other abnormalities that can be detected using stress tests include certain types of arrhythmias, such as premature ventricular contractions and atrial fibrillations. For this week's Health Watch, I'm Dr. David James.